Hello, 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 everyone. Hello, hello, everyone. If is there anyone, is there anybody? I would love to hear if you can hear me. I'd really love to hear if you can hear me. I'm using headphones. Hello, can you hear me? I would love to hear if you can hear me. Um, Please write in the chat if you can hear me and if I'm loud enough. So So, as you may have seen, today we are discussing endometriosis, painful periods, and all that. I want to thank everyone who has shown up and everyone who will show up. I don't see anybody currently. Um, just in case you pass around, please let me know if you can hear me. Now, let's dive into the topic of today, endometriosis and painful periods. I would like to start by saying that I am Riti Explorer, and on my channel, I talk about life and health education. I have done quite a few videos now about health education. Sorry for the light, it's I don't know. I see myself. I feel I see myself in a strange way. Do write in the chat also how you see my screen. I don't know if this lighting is good enough for you or not. If I can change the light, I'll be happy to hear that. So let's talk about endometriosis and painful periods. I would like to start by addressing the topic of painful periods. And I have plenty of 3D animated videos on my channel discussing women's health issues, endometriosis, painful periods, and many more, and many more are to come. They are in the pipeline. So this is the channel if you really want to learn and share about women's health issues, issues that affect women on daily basis. Oh, how I wish I could hear myself, how I wish I could know how the audio is. Unfortunately, I don't know how to test the audio. Um, yeah, I really hope that somebody can write me in the chat if they can hear me. Please, if you can hear me, just drop me a comment in the chat or in the comment section. Yeah. So, painful periods. This is something that affects many people. If I may just start by giving an example, while I was growing up, my elder sister, oh my gosh, I think I can't remember how old I was, but I was pretty young in primary school. And I used to see my older sister whenever she had her period, like she would fall sick like 2 days before the period, and she would be sick like for a week, a whole week, really sick, crying and groaning in pain and literally only staying in bed. And so I was wondering as a small girl what that was. And all I saw was my mom was really stressed. She was really stressed. All of us, everybody actually in the house, everybody knew my sister had a period because of the kind of pain that she had. But I didn't really understand what that was until I was until I went to the nursing and midwifery school. I didn't have an idea what that was. And today I am happy to be able to share all that I know about that. Today I know that my sister might have had either just extremely painful cramps during the period, or she had some other problems. And indeed, recently she underwent an operation whereby she got her uterus removed because of fibroids. So now I know that her pain was due to fibroids, or maybe she also had endometriosis or something. So painful periods is something that really affects a lot of women, a lot of girls, but many people, or many of those cases, go unaddressed. Nobody knows what is happening. Nobody seeks help. No one goes to the healthcare provider, because in certain societies this is normalized. It's taken as normal. If you're a girl, you're meant to have painful periods, period. Some people believe like that. I don't believe like that, and it shouldn't be like that. Actually, that is not the case, and it shouldn't be the case. Um, Now, painful periods may mean many things. And painful periods, I mean, there is a science, there is a whole science behind painful period. There is a reason why some periods are painful. I don't know if there is any woman who experiences periods that are completely painless. Because when you look at the physiology, um, the uterus is, so during the menstrual cycle, the uterus is preparing itself throughout that process. It's preparing itself to have a pregnancy. So during every month, during every menstrual cycle, a woman has a certain chance of becoming pregnant, and the body prepares itself for a pregnancy during that time. And so, during a menstrual cycle, when the body prepares itself for a pregnancy, there are certain changes that occur on the uterus. The uterine lining, or rather the inside of the uterus, actually, if you know the anatomy, you know what I'm talking about. The lining of the uterus becomes thick. It's called endometrium. It becomes very thick. It becomes then also, it has a lot of blood supply. I mean, it develops a lot of blood vessels to supply the uterus with the plenty of blood supply in preparation for the baby. So that inner layer of the uterus, which is called endometrium, becomes thick during a certain period, during a certain time in the menstrual cycle, in preparation for a coming pregnancy, or in preparation for a possible pregnancy, such that if during that menstrual cycle a woman becomes pregnant, um, then the body is prepared, the uterus is prepared. The fertilized egg is able to bury itself into the endometrium and start growing from there. But in case there has not been a pregnancy for very good reasons, because you're young, because you're not ready, because you're not married, or for whatever reason, there is no pregnancy during a certain menstrual cycle, the body, or rather the uterus, sheds that layer. The uterus lets go of that layer it had developed, the endometrial layer, the thick layer. with a lot of blood supply, the uterus tries to let it go and reorganize itself. So every month, they are during every menstrual cycle, the uterus is changing. Sometimes this endometrial layer becomes thick and sometimes thin because it's constantly preparing itself for pregnancy and constantly shedding off that layer if the pregnancy does not occur. So it is actually that process of shedding off the endometrial tissue that causes or that brings about the pain or the cramps that women do experience during menstrual periods or during menstruation. And so based on that physiology, one can say that is it's normal that a menstrual period or menstruation comes with some pain, but so much pain that affects your life is not acceptable. So some pain to a certain degree is associated with the physiology of that process. That's and I think that's why people say it's normal for women to have pain during menstruation. But I will come to that point. It's not the same. Not every woman experiences the same. Women are not the same. This the experiences are not the same. Even pain tolerance um, varies between women. So it's not a good thing. It's not a wise thing to say menstruation is associated with pain and that's normal. It's never normal. It should not be normalized. And so I have told you a bit how that process happens, like why are there cramps. So while the the pregnancy has not occurred during that menstrual cycle, and the uterus tries to shed itself and reorganize itself afresh. Um, that process comes with some cramps because it's shedding off and it has all that endometrial tissue has to be expelled through the cervix and through the vagina and out. And that's what comes out as menstruation. During that process, um, the uterus, of course, undergoes some contractions, like the uterus contracts a bit. Yeah, a bit is relative. So in that process, the uterus contracts, and that can bring about pain as well. It contracts in order to propel or to eject that endometrial tissue out through the cervix and through the vagina as menstruation. And so that process also can trigger a hormone or rather some chemical compounds called um, um, prostaglandins. Prostaglandins are actually some kind of hormones that can be produced in that process. And those are actually some of the factors that bring about pain. Prostaglandins cause pain. If you were in this field of women's health, you know what I mean. Prostaglandins actually cause uterine contractions. They act on the cervix and on the uterine muscles, and so they really can cause extreme contractions causing pain. So the mechanism of cramping actually involves the normal uterine contractions that come about because of wanting to eject the endometrial tissue because of lack of a pregnancy during a certain menstrual period, menstrual cycle. And then the second factor that brings about cramping and pain is the prostaglandin. That is something a bit complicated if you're not in the field of women's health, but good to know that these two factors bring about pain during menstruation. And so, um, coming back to the point of pain during menstruation, a certain degree of pain is can be tolerated. It's normal. It's associated to that process. But what is pain? If you ask me, my pain tolerance is different. Even very slight pain for me is so much pain. I really have a very low tolerance to pain, and there are women who have even a lower tolerance to pain than I, and others a higher tolerance. So pain perception is really subjective, and this has to be considered. So if you think that you have pain during your menstruation, you should be able to know how much pain you can tolerate and how much pain you can't tolerate, and that's just okay. And should you be able should you not be able to tolerate a certain amount of pain, it's okay to seek medical care or health care. Visit your healthcare provider and discuss that with them, and then there will be a solution for you. I think I will come to it because there are strategies, but also some remedies for menstrual cramping. So don't forget that there is always help, and don't forget to visit your healthcare provider in case you cannot tolerate the pain. Another thing I would like to say about the pain, period pain, is that just a moment. I wanna see. Uh, I am live. I am live. I am live. Um, just visit. So, sorry for that. I was just responding to a message in my YouTube studio. I don't know why this live is not showing. I know that I'm live, but some people can't see me, can't find me. So I was just responding to that. So where was I? I was saying that pain. So menstrual pain. Sometimes that pain cannot be underestimated. I mean, menstrual pain could mean something else. As I've said, it could be a normal process, a normal physiological process of menstruation, but it can also mean something else. In many cases, if you experience extreme forms of pain, that may mean you might have something else, probably endometriosis or even uterine fibroids. As I said, my elder sister, when she was a teenager and when she was an adult, and anyway, as long as she started having her periods, as long as she had her periods, she was having immense pain. And later in life, actually quite recently, she her uterus was removed because of fibroids. She had a lot of fibroids. And so period pain can mean either you have fibroids, you have endometriosis, or you have something else. So if you think your pain is abnormal, if you think your pain is uh, so much, or if you're just concerned about cramping and painful menstruation, it's very, very important. It's very advisable to visit your healthcare provider because it might not just be a normal physiological process. And so that brings me to the question of endometriosis. I would like now to address endometriosis, and I would like to start by saying that So many women have endometriosis, but it's really, really difficult to know whether they have endometriosis or not. It's very difficult. It's actually estimated that 10% of women in reproductive age group have endometriosis. But if it's so difficult to diagnose endometriosis, it means that even this statistic is not correct. So this is the statistic that we have. This estimation of about 10% of women within the reproductive age group who have endometriosis. Those are only women who have been able to access healthcare and women who have been able to be to be treated, you know. And there are so many women who never access healthcare. There are so many women who never visit a healthcare practitioner, and there are also many women who are dismissed with their complaints. You know, they are dismissed by their healthcare provider. It doesn't matter who, a physician, a nurse, a nurse practitioner, a midwife, or whoever it is. So many women have been dismissed. Therefore, it's so difficult to diagnose endometriosis. But it's not only about lack of access to healthcare. It's also about the difficulty that endometriosis has to diagnose. You know, endometriosis has the symptoms of endometriosis are really, really vague. Vague, I mean, they are similar. Most of them are similar to other conditions. For example, um, um, why are people not able to access my life? Just a moment. I want to let me share this one. Share. Just a moment. Just a moment. Let me fix something. Bear with me. Bear with me, please. Let me fix this. Um, how will I find? Uh, just a moment. Um, just a moment. Let me fix this problem because I don't understand why nobody can see me. I don't understand this. I don't understand this. Um, sorry, sorry. Oh wow. Yeah, I didn't know. You know, this is the third time that I do a live, and today I prepared way in advance, but I don't know why. I don't know why it's like this. I really don't know why it's like this. Uh, I don't know. Maybe I messed up with the settings. If you know how messages are visible, if you really know, or if you would be aware of which mistakes I would be making now, please let me know because I don't see anyone, and this could be because, oh my gosh, Yeah, I don't know why people cannot find me story. Uh, um, so, sorry for that. I had to fix this. I don't know if I fixed it, but let's see whoever comes around. And in case you miss it, in case nobody comes around, I hope that this can appear on my page so that people can watch later. Oh, sorry for this. This technical mishap is really messing me up. Oh my goodness. Now I was saying that endometriosis diagnosis is difficult because of the ambiguity of symptoms presentation. I mean, first of all, we have seen that if you have painful periods, it could mean you might have um, endometriosis, or you might have um, another condition, or even uterine fibroids. But we have also seen that if you just have painful periods, it might mean that you have endometriosis. And so it's very, very hard to for doctors to diagnose endometriosis, first because it mimics, or the symptoms mimic, other diseases. So let's say you have painful periods. You know that that doesn't really tell so much. It could mean anything. And so it takes a very experienced physician or a very experienced healthcare practitioner to think that that might be endometriosis. And indeed, it might be endometriosis, or it could be something else. We have also said that it's very difficult to diagnose it because of many people just don't access the care that is supposed they are supposed to access. There is another problem to diagnose endometriosis. Actually, one needs to do some kind of operation. That operation is called laparoscopy. So they need to, the doctors or the surgeons or gynecologists usually need to diagnose endometriosis by performing a certain procedure called endoscopy, whereby they using certain visualization, they poke holes on your tummy, they poke holes on the tummy and visualize, literally visualize using specialized tools to see if there is endometrial tissue in your uterus or whatever. And so you can imagine that diagnosing endometriosis is so complicated. You need that kind of surgery to be able to be definitively diagnosed of endometriosis. And so, how many people want to do that? How many people can afford that? How many, that's just not accessible to a lot of people. And then you have another issue to diagnose endometriosis. So let's say, yeah, they visualize. So they visualize, they do this minor operation, the surgeons do this minor operation, or it's not minor operation, it's called laparoscopy. Sorry, I said endoscopy. It's called laparoscopy. So when they do that laparoscopy to visualize where or if the endometrial tissue is in your uterus and where exactly it is. They face another challenge because the endometrial tissue is not always only in a certain location. You know, the endometrial tissue, that endometrium, is not only growing in a certain area of the uterus. Those endometrial tissues that cause pain, they can grow anywhere in the uterus or outside of the uterus, and they can even go elsewhere. I have videos on my YouTube channel where this is discussed, but I just want to say that some of those tissues, some of the endometrial tissues could be on the ovaries, some could be inside the uterus, others outside in the abdominal cavity. I have also seen some patients or some patients who claimed or who had it on the diaphragm or on the lungs, and this um, affected their breathing. And that's really complicated when this tissue is spread all over the woman's body. It's really complicated to diagnose. So it makes it really, really complicated to diagnose and to manage. And so endometriosis is so complex. It's a disease that many people are not aware of. Many people do not talk about it. Many people do not take it seriously. Yet the effects are far fetching, far reaching, and debilitating, you know. And now, let's say we have seen now the difficulty that comes with diagnosing or getting to tell someone that now you have endometriosis. And let's say you have been finally diagnosed of endometriosis, let's say clinically, where your healthcare provider using the signs or using the symptoms that you present really diagnoses endometriosis. You have to go further and have this laparoscopic examination to be definitively diagnosed of having endometriosis. And so it takes many, many years. It takes long until someone has a diagnosis of endometriosis finally. And research has shown that it takes even up to something like 15 years, anywhere between 7 and 15 years. Even other women have reported longer periods than this. It takes such a long time to diagnose. For for some of the reasons we have discussed, but some of the reasons why that is the case are, of course, not known. Um, and so it's really really a complex disease, and I would like everyone to be sensitized about it. Recently, in my country, Kenya, there have been heightened discussions about this disease because some influential people or some social media influencers have actually died, and they claimed they died of endometriosis. And they even went to so many countries as far as the US and Turkey to be able to get a diagnosis and also to be treated. Unfortunately, they passed on, they died. And so, because of that, so many people in my country, Kenya, are very, very sensitized about endometriosis. And all over, you see people asking about it, young people asking about it, but people are also very afraid about it because some people have died and they have claimed that they died because they had endometrial tissue somewhere on the heart or on the lungs or something like that. And just so you know, endometriosis also has stages, just like cancer has stages, and so there are mild stages, but also very advanced stages. So it can be that You have endometriosis, but it's really in its early stages, or you have it and it's in its late stages. And so the more advanced it is, the more difficult it is usually to treat, because treatment involves two things. Um, there is there is treatment that involves the use of medication, that is pain medication, and hormonal preparation. So hormones, some sudden hormones that you like pills that people use to prevent pregnancy can be used as first line treatment for endometriosis. And so there are certain types of pills, or hormonal pills, hormonal contraceptives that are used to treat endometriosis, including pain medications, especially non-steroidal anti-inflammatory uh, pain medications like ibuprofen, but also other advanced forms of non-steroidal anti-inflammatory medications. And so that's how you treat them. But there are also more advanced forms of first line treatment involving medications. And those are some kind of antagonists. I wouldn't go into that. If you want to know that, please check out my videos on my YouTube channel. I have a, I have listed, or I have extensively discussed endometriosis and this and the science, and also the treatment, the current management of it. So please visit my channel and get to see that video. And if you don't find it, you feel free to write me in the comment section, and I will send you a link to that video. And another thing, so there's this first line treatment of endometriosis, which involves oral medications, so hormones, and other other medications, and also pain medications. But there is also surgical treatment, and this is especially good when um, endometriosis is in its early stages, because they are able to remove those endometrial tissues um, before they spread to other parts of your body. Therefore, the surgical treatment is actually, anyway, it's indicated for all stages of endometriosis, but the earlier it's diagnosed and surgically treated, the better. The problem with surgical treatment is that research has shown that endometrial tissue never goes away completely. You know, surgical treatment can relieve endometriosis for a certain amount of years, maybe 2 years, maybe 5 years, or even shorter or longer, and that endometrial tissue returns. So that's a major challenge in the management of endometriosis. And imagine if you choose to take oral treatments or first line treatment, which is the oral treatments of hormones and antagonists and um, and pain medication. Imagine if you're a woman wanting to have children, or to have a family. Endometriosis itself, it can make one become infertile, and the treatment that you receive is also preventing you from becoming pregnant. And so endometriosis itself and its treatment is like working against you if you really want to have a family at this moment or in the future, because who knows if you're, let's say let's say you discover you have endometriosis and you are in your mid 30s or in your late 30s, and you want to do the treatment at the same time you want to have family, you want to have babies. So what do you choose? Where where do you place priorities? Do you want to treat your disease, or do you want to let the disease and try to create a family, to have children? Actually, in my work, I met a woman who was about, I think she was something like 45 years old, and or she was 45 years of age. And this woman, she had always wanted to have a baby or to have a family. But then she realized so late that she had endometriosis because, she had infertility since she was, let's say, 30. Not let's say, she was about 30 when she wanted to have a family, she wanted to start having babies, but then it didn't work out and nobody knew why that was the case. She went to so many doctors. I mean, um, here in Switzerland, people are accessible to healthcare like no other country. So she went to her primary healthcare provider so many times. It was never diagnosed. She kept changing her primary care provider, who was, I think, a family doctor. Sometimes you are lucky to find a gynecologist in a primary care provider, but I think every woman has a gynecologist, as long as you are, as long as you yeah, as soon as girls start having menstruation all through their reproductive age, they have a gynecologist. And so access to a gynecologist is so universal here. So this woman went to her gynecologist, but she kept changing them because she wanted to know why it was not happening, that she would get pregnant. She wanted to know. Nobody told her. It was never diagnosed, so she kept changing and trying to find a solution, or trying to find an answer to her problem. It was never found out until when I met her. She was 41 years of age, and she was really in a very bad mental state because she had just been diagnosed of endometriosis. Imagine, she began looking for help when she was about 30, and at age 41 she is diagnosed of endometriosis. And then everybody knows that this is why she has not been able to conceive all this time round. And she had actually, a few times, I think she told me twice she had conceived and she had a miscarriage. Yes, we understand this because if you have endometrial tissue in your uterus, of course, this might happen. And she was so lucky that twice she had been pregnant before, although it didn't succeed. And when I met her, she was so emotional, and she was crying a lot, saying, "Oh, now I know. Now I understand. This is the reason why I had miscarriages. This is the reason why it has been like this." And so she imagined uh, something like over 10 years, she had been wanting to know what was happening to her. And her diagnosis only came after, like, in longer than 10 years. This for me was really shocking to see that these people, a woman in such a country like Switzerland, with universal health coverage, with unlimited access to gynecologists or primary health care, could undergo such kind of issues. What about countries like in my own country in Kenya, where without money you can't access health, and you may even have money, but that access is far away from reach? So this was heartbreaking for me to see, or to hear the story of this woman. And by that time, at the age of 41, She was in a very poor mental state. She couldn't think about what she wanted to do anymore. So she didn't know whether she should try to do in vitro or reproductive or health assistance. I mean to do IVF. She didn't know whether she should try to do IVF at that age or try naturally to conceive after an operation, or go in for an operation to remove the endometrial tissue, or take the hormones that could prevent pregnancy. You see what I'm driving at. It's so complicated when you have endometriosis, and it's so complicated trying to imagine what your priorities should be. Should your priorities be having a family? I mean, having children or having babies, or getting treated? And what kind of treatment? And is it even possible to have a family that you want, that you wish to have after treatment? It's a once you get the diagnosis of endometriosis, it's like your whole life turns around. You have no idea what to do. You have no idea where your priorities should be. And you have no idea really how the course of that disease would go. And so I really, 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 really sympathize with women who have this condition. Um, I have to declare something. It's so sad to say, but I also have to say that I was diagnosed with this condition, endometriosis, and uterine fibroids, and then I could relate with all my experiences of before and all my life experiences until today. And it took me a very, very, very long time just to have a clear mind about what I wanted, what priorities I wanted to have in life. Did I want to have a family? Did I want to be treated? Did I want to do um, this and that? What did I want to do? It's really, I have to admit that this is, once you get diagnosed of endometriosis or even any kind of condition involving the uterus, it's like your whole life turns around. So it's really, really important to have a community of like minded people, as I always say, people who understand each other or one another, and who can support one another. Because in that moment when you have no idea what to do, what you should be doing, where you should start, where you should put your priorities, it's really important to have a network of people who have been through that or who know about that, to be able to support you. Even if they don't give you solutions, of course, no one should give the other a solution, but just to be there to support you, to help you have a clarity in your mind about what you should do. It's really, really important. And I feel for every woman, and this is also why I have a huge passion to talk about these issues, to to educate and sensitize everyone, young and old, women and men, boys and girls, to be aware of this, but plus many other women's health issues, because knowing is power, knowing is wealth, knowledge is wealth, knowledge is power. And it's only by sharing, by educating, by sensitizing, and by supporting one another that these problems will be solved. And so that's a bit about my passion. I become really, really emotional when I talk about this. Bear with me, but this is really something that I am passionate about, and I want that every woman finds a way. Every woman diagnosed with endometriosis finds a way to deal with that, or finds a way, an easy way to access healthcare and get the right treatment. And importantly, it's not always about treating, it's also about really getting to know the priorities of that woman or of that couple, their what they want to do with their family and what they want to do with the treatment. It's really, really, really important to be holistic, to look at a couple or a woman who has endometriosis. It's so important to look at that situation in a holistic view, to be able to address all aspects of life that come into play in that diagnosis. And so we have seen how difficult it is to identify endometriosis, to diagnose endometriosis, and to treat endometriosis. And this is a disease that is so unknown. And as I've given you an example, that there are people, prominent rich people, dying, claiming they died of endometriosis in my country, Kenya, but also here in Switzerland. I have given you a scenario where a woman, or rather women who have access, unlimited access to healthcare, also face a lot of challenges to to in their journey of diagnosing and managing endometriosis. So this is a global problem that affects all women, all across all cultures, across all nations. It's a global problem cutting across all the diversities. And so I would urge anyone, if you're here or if you come across this video, please spread it to other people, share it with other people, share the word with other people. Look up for more information on my channel or from whatever sources that you prefer, and get to share with as many people as possible. I wouldn't say that this is a problem that affects only women. Of course, it's affecting the woman's body. It's affecting the woman and the woman's body. But the woman does not live in isolation. There is the partner of the woman, there is the family, there is the friends. And so everyone is affected whenever one woman is diagnosed with endometriosis. For example, one of the women that I met here in Switzerland during my work in the hospital, um, she told me actually she was so happy, and she couldn't express her happiness that even with endometriosis she was able to have a baby. And the time that I met her, she was my age. And so we talked a lot about many things, many issues. And so she disclosed to me that, she will forever be thankful that even with endometriosis, she managed to have a baby at the age of 42. This is a different woman I'm talking about. And by the time that I met her, she was going to have her uterus removed because of the endometrial tissue was too much. And she also had something else called adenomyosis and also some fibroids. So she decided to get rid of the uterus because she had so much pain, and because she was lucky to have had a baby through fertility treatments. And so you can imagine that this woman at the age of 42, she managed to have a baby through fertility treatments, and she had been having this problem since she was a teenager. Since she started having her periods with age 12. she started having these cramping pains. Until then, when I met her, she was 42 years old, and she she was tired. All she wanted was to get rid of her uterus. And so you can imagine this is a real problem that affects everyone. And this time I met her, she had her partner with her, and she told me it's really it was she survived this disease for all that long just because she had a very supportive partner. And this man was beside her early in the morning as I prepared her to go for a surgery to remove her uterus. This man was with her, and he also spoke with me, and he told me how affected he had been to see this woman suffer all those years. And he was so happy that finally she was going to have her uterus removed, but he was also very grateful that at least they had a baby before this uterus could be removed. And so you can imagine this is a Western society where people say, oh, it's okay not to have kids, it's okay, life is easy. But human beings are human beings, doesn't matter where you live, where you are from. So I'm saying this because I just want to say that a diagnosis of endometriosis affects everyone, whether you're a man or a woman. As long as you are connected somehow to the woman who has endometriosis, you are affected. Therefore, when dealing with endometriosis or when managing endometriosis, it's really important to think about the men or the partners of the woman that is affected, because everyone is affected in that game. So that's what I can say in my in my experience with this disease. And now we have seen the signs and symptoms. We have seen the challenges that come with diagnosing and treatment, and I've given you some examples of the situations that I've seen. Um, I would like now to um, I would like now to address something else. I have mentioned a bit about the uterine fibroids. So we have talked about cramps, we have talked about endometriosis, and we have. So now I would like to talk briefly about um, the fibroids, uterine fibroids. I also have a video about uterine fibroids and also like what you should eat to help you to either prevent or to help with shrinking the fibroids. Now, before I come to fibroids, let me discuss a bit about other management of endometriosis. So I have told you about medical management using medicines and surgery. So medical and surgical management, but you can also use the best natural ingredients, food, food and natural food supplements. You know, um, there is some research at the moment regarding dietary, like what you can eat to help you with endometriosis. But also, we know that nature has its own way of healing. I am one person who looks at science, but looks at the whole thing complement like holistically, and therefore I can never miss to speak about dietary or um, other remedies that you can use to help you with either reducing endometrial symptoms relieving the symptoms or even preventing it if you're very young, or rather, who knows, maybe these remedies could also um, help reduce the spread of the endometrial tissue. And so I what I've read, there are several different diets. As you may see, people do different types of diets, especially intermittent fasting. But I would say the most important thing that I would advise is use of natural anti-inflammatory foods. Like fruits and vegetables. If you're in Africa, for example, in Kenya, we eat a lot of leaves, a lot of vegetables. I mean, there are so many different traditional vegetables, and you can never go wrong with those. The problem with that is how you cook them, which fats and which oils you use to cook them, with what you eat and how much you eat. That's the problem, and that's a whole other area we cannot get into at the moment. So I would recommend healthy, plenty of natural vegetables, um, plenty of, let's say, if you eat meat, that's okay. But in this case, I wouldn't say a lot of red meat, maybe some white meat, but you have to be do everything in moderation. That's my take. Oh, who is there? Someone is there. Someone has sent me a message on something else. Okay. Okay, I thought someone checked in. Sorry, I was just checking. So, diet can never be underestimated, especially anti-inflammatory diets. And this is a whole area we can get into. I will be doing a video about those, but there is already a video on my channel and on many other channels that discuss this kind of topics about dietary improvements you can make in order to help you deal with endometrial symptoms or even reduce the experience or the spread of endometriosis. Therefore, please check out that video on my channel, or get in touch with me. I can send you material. Like if you like reading scientific literature, I can as well send you some scientific literature about that. So just get in touch with me. So let me discuss briefly about fibroids, uterine fibroids. Oh wow! I told you already about uh, oh, sorry. I have to correct something. I have to correct something. I must correct something. I have to quickly check something. Bear with me. I just got a message that my uh that that my video, my live is private. Sorry. Why is it private? That's why people are not able to to get in. Oh my gosh. What did I do? I am new to these things. It's the third time I'm doing it. I think in future I will never schedule it. I will just go live immediately because I had scheduled it. I prepared it in the morning. Oh yes, I see. Oh, sorry. Ah, it was private. Sorry. I'm so sorry for my viewers. I didn't know that I had to. I am live, and I don't know why it's private. Wow. Why? Sorry for that. And I'm just learning. I'm new on YouTube and bear with me, please. What a shame, but I'm not ashamed of that because I didn't know. I didn't know. Um, Now I know after this experience, I know what to do next time. Uh, oh, yeah, yeah. Uh, so, my goodness, I had left it on private. I'm so sorry for my viewers. Next time, I don't understand how I am live, it's recording, but it's private. My viewers are sending me messages to say it's private. I am private. I'm so sorry. Let me see who is coming around. Ah, wow, 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 wow. Ah, my goodness. Now let's see. Now let me quickly get out of topic. Hmm? Let me quickly go out of topic. To look, to be honest, I don't know YouTube. If you remember, I said I said it YouTube because I wanted to have something else to do beside my PhD, which was so stressful, and to deal with my stress, which has been so stressful. To deal with my stress, I decided I will be making videos because it's so nice to see myself. It's so nice to say my mind. I feel so good to share. Ah, yes, now I see someone. Someone is there. Do you hear me? Please type something if you can. Do you hear me? Sorry so much. Sorry so much. It's because I don't know. I don't know YouTube. I don't know all these things. I'm just learning. um. Yeah. Ah, super. Thank you so much, Michelle, for telling me, for giving me the feedback that you can hear me. I am new on YouTube, and this just shows you how I'm struggling and how how one should just show up with all the imperfections. You know, there are so many people, and I thank all those people teaching others on YouTube because every day I learn something. Every day I learn something. Today I have learned. I made a big mistake by leaving my scheduled live leaving. I left it private until I have been informed by very good friends and subscribers. Sorry, I'm so sorry for that. And this is how we continue learning. This is how, with all our imperfections, we show up, we keep showing up. And I'm happy that I can still do this despite my shortcomings. Now, if you can hear me, my goodness, I've spoken already for longer than an hour, and I've been talking about endometriosis and painful periods, cramps, and now I just wanted to get into fibers. Just to mention a bit about fibroids. If you have any question, please write in the chat and I will address it as fast as possible. I'm looking at the chat, and so just write it there and I will address it just now. Ask any question and I will address. I'm so sorry for this mistake because I posted everywhere. I even posted on my on the community chat, on the community icon, that I was going live, and I really prepared this live very early today in the morning, and so I gave it a lot of time for my subscribers and other people to prepare themselves, but I didn't manage. I'm sorry for this technical hitch. So just write me in the messages in the comment section if you want me to address anything, because I don't know now what to address. I have been already speaking for longer than an hour. Now, I will quickly talk about uterine fibroids. As I said, you might have painful periods, but then they may mean you have fibroids. And so I said the cramps, painful cramps, might be normal because of the normal physiology, which we talked about. Hello, hello, hello. I can see Aileen is also there. Michelle and Aileen. Hello, my dears. Although I see that there's only one person. Hi, hi. Hello. Thank you so much for passing by. Thank you a lot. Thank you for the support. And so um, I will see what to do. I have a transcript of all this information, and I will just print it. I will compile all this information and give you as as a document to read, because I know it takes a lot of time and money to view videos. It takes you a lot of time and money to watch, probably. I will compile text. For those ones of you who prefer to read the text, I will compile it for you. Otherwise, there are many videos on my channel which you can view, which you can watch with a lot of information. Oh, I see a message. Thank you so much, Michelle, for asking. Um, does fibroids have age limit? That's a very, very, very good question. So uterine fibroids. I don't know how to share the pictures. Forgive me. Next time I will be able to share with you photos and other pictures so that you can see exactly what I'm talking about. Actually, I have very, very good photos if of how it looks like, all types of fibroids. So fibroids, all these things, all these problems that affect women, they begin as soon as a girl or a woman reaches puberty. They begin in puberty, and some of them vanish, or they end after menopause. So there's this window called reproductive health um, age group, and I think this is I don't have the real number, but I think it's beginning from. I'm so sorry you caught me on this. From the time a girl gets menstruation, so let's say age 12, up to something like age 51. So this reproductive health window or reproductive health age group, within that age, let's say from 12 to age 51, years old. These problems are within that window. They don't exist before, and some of them go away after menopause. But menopause comes with its own share of issues because the hormones drop. Like yeah, there's another complication related to hormones after age 51 or 52, and that brings other problems. But now, going back to the question, my viewer has just asked if there's age limit for fibroids. They can set in anywhere within the reproductive health window. So there are girls, actually I have seen a young girl of about 24 years, sorry, of about 14 years, who had uterine fibroids. Oh, I might have to charge my phone. Sorry, I'll just move. I'll just change location. Let me just change location. Otherwise, my computer will go off. I just keep talking. I just keep talking. So, so they can you can be affected by fibroids at any age. Let's say at the age of 14, as I have seen, or at the age of 40, or at the age of 50. It doesn't matter. Um, what matters when you have fibroids are also different, you know. There are different types. Sorry, I had to change location because my computer was going off. Oh, hello. I am Sangura is also there. Hello, Julie. Thank you so much, guys. Thank you for the support. Thank you so much. Now let me continue talking about the fibroids. So at any age within the reproductive health age group, you can be affected by fibroids. Some fibroids grow so big, others are so small. You know, I saw a woman who had, when I was in training, one woman whose belly was so big, she looked like she was pregnant with three kids or four babies inside the womb. And after she was operated, they put the fibroid in a big basin, a big basin. You know what I mean? A big bucket. My gosh, it was like I have never, I could never imagine that such a thing was inside someone's body. So they can be very minimal, very small, or very large. And when they are so large, the only treatment is to surgically remove them, is to operate and remove them from the uterus because they also affect fertility. But fibroids are not cancerous, they are called benign growths in the uterus. They are not cancer, but they may affect fertility. There are many women who have had babies who have had successful pregnancies with fibroids, but there are many women who have failed to have a pregnancy because of fibroids. And fibroids are very complicated also because if you know the anatomy of the uterus, oh, next time I have to really show you illustrations. Um, there are some fibroids which are inside the uterus or outside the uterus or inside the muscle layer of the uterus, and depending on where they are and how big they are, they may affect fertility. They may affect your ability to have a successful pregnancy. And that's really the biggest complication, the biggest problem with fibroids. Otherwise, you may have fibroids in your body and live with them. They will not cause a problem. Of course, your body changes because your tummy might be so big, and also during menstruation, you may have more severe cramps and pain because of them, but they are not cancer. Many people are afraid of them because they think they cause cancer, but actually not. And once when you have fibroids and you don't get operated to have them removed, you may use diet to help reduce them or shrink them, diet and exercise, or you may, after reaching menopause, those fibroids undergo a process called calcification, where they kind of reduce in size or kind of dry up because they are actually driven by hormones in your body. And at menopause, the hormones change, your hormone levels drop, certain hormones drop completely, and then these problems go away. So menopause can be seen as a good stage of life where a lot of reproductive health problems vanish, but there are other problems that set in. That's when a lot of women have cancer of the cervix or cancer of the uterus or cancer of the endometrium or something like that. But I'm not saying that um, in at menopause you'll have cancers. I'm just saying that some problems become less when you attain menopause and some problems become severe. Is there any other question, my dears, in the chat, in the comments? Whoever is listening to me, you see how passionate I am about this topic. I am so passionate because I really want everyone to be educated about this, to be sensitized about this, because as a woman, if you have anything, any small thing, you get so worried. You just think, I don't know if I'm just the only one, or I don't know. But any small thing, we are always thinking big things. Like you have some small pain in the belly, you're thinking, oh, cancer or something. So I know what it means to be a woman and to have anything. And so this is one of the reasons I want to share all my knowledge, everything I know with you guys, um, or with you, my viewer. I should stop calling you guys because you are an individual. My viewer, you are unique, and I should just be able to address you and not you guys, not in general. So that's a little bit about uterine fibroids, and there are different types of fibroids. Let me just respond quickly. Oh, oh, hello, hello, guys. I see you all. I see you all. I see you, and a big shout out to you. Somehow I'm unable to write. Oh, now it works. Oh, yeah, 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 yeah. Um, yeah, so a big shout out to all of you who are watching me, who are in the chat. Thank you so much for checking in. Thank you for all that. And by the way, let's talk about the different types of fibroids. So, as I said, you may have fibroids inside the uterus or outside of the uterus. Um, I have a sister who had fibroids both inside and outside, and her whole uterus needed to be removed. Um, I have had um, I have had some fibroids, but inside, no, actually outside of the uterus, but they have stayed like 1.2 millimeters for a very, very long time. They stayed really small until so for a very long time they were so small until when I became pregnant, they grew like exponentially. They grew so big and caused so much pain. Luckily, they didn't do anything to the pregnancy. They didn't affect the pregnancy negatively because they were outside of the uterus on the external uterine wall. All they did was they put pressure on my organs, like the stomach, the liver, the kidneys, and everywhere, the viscera. And then I had so much pain. I had so much pain throughout the pregnancy just because of the fibroids. So you may have fibroids, but they may or may affect your pregnancy or your ability to become pregnant. And those may be outside of the uterus, inside of the uterus, or in the muscle layer of the uterus, in the uterine wall. So when they are outside, they are called extramural fibroids. Inside, they are, I think, intramural fibroids. And then there are those ones in the muscle. Really, they just bulge, but they are just inside the muscle. And then you may have some fibroids that grow from inside the uterus out through the uterus, through the cervix, and those ones are called pedangulated fibroids, and those are quite dangerous because they are like most fibroids are just like a round collection, like a ball, but you have those ones that have something like a neck, like with a thin neck and with a round head. And those ones are really dangerous because they hang loosely into your uterine cavity, and sometimes they may strangulate, or they may coil and cause a lot of pain, or even they may bleed, because of that coiling. These are called pedangulated fibroids, and they are really, really um, tricky. But fibroids can be very well removed. I want to use an example of myself, or so let me say my one of my sisters whose uterus was removed. That's an extreme case, and actually many women prefer to have their uterus removed if they have more than one fibroid. Fibroids can grow anywhere. They can be so many, they can colonize the whole uterus, or you may have just one or two or three. In my case, I have two small ones which grew during pregnancy but then went back. um, but they are outside. So you have, depending on where they are, you may choose to either have a surgery to remove them, to remove the fibroids, or to remove the whole uterus. In the Western world, um, I think people still remove the uterus depending on the severity and where the location of the uterus. In Kenya or in Africa, many doctors prefer to remove the uterus. But I just want to say that is not the only form of treatment. That's not the only way you can get rid of fibroids. First of all, to diagnose fibroids is easy. You can feel, you can palpate the tummy and feel them. You can literally feel them. Or they can also do some visualization through the birth canal. They can see whether they can do some kind of visualization with cameras with cameras and some contrast substances to see where they are, if they are inside the uterus, and if they are in the muscle or outside. This can easily be seen through an X-ray scan or pelvic scan, and so it's easy to diagnose them. To treat them is also easy because it's surgical. Either they can be they can be surgically removed through the birth canal, like they will put operation equipment through the birth canal and literally remove them if they are inside the uterus, or if they are outside of the uterus, they can do laparoscopic um, operation and remove them. And if they are within the muscle layer, there are medical treatments that can remove them. Or nowadays, I think there are surgical techniques that can also do that. But also, the question here is, ha- have you had babies already? Do you plan to have babies? Or have you had enough? All these questions. Your family planning will determine the course of treating your fibroids or treating your endometriosis or anything. So all these things are connected, and that's why it's very, very important that people get this information, especially young girls. Young girls, I mean, teenagers, people in their 20s, and then when you're in your 30s, of course, and people, women at all ages need to know about this information, because you really need to visit your healthcare provider to be able to establish whether your reproductive health, your reproductive organs are okay. That's part of family planning. Family planning does not only involve taking hormones to prevent pregnancy. It also involves knowing at an early age if you want to have a family, or you want to have children or not. And if you know that at some point in your life you will want to have a family, or you will want to have children, it's very important to start visiting your midwife or your gynecologist or your nurse practitioner to be able to evaluate your reproductive health system, your reproductive health organs. It's really, really important. You know, there are also clinics. I think I lived in Nairobi much more than in the village, so I know a bit about what happens in Kenya, in Nairobi. There are certain hospitals where or clinics where you can easily go and do a check, a comprehensive women's health check, where they check you for so many things, including all these things, and including even screening for cervical cancer, something called a pap test, pap smear, yeah, pap smear test. And so, as a woman, as a young girl, it's not nice to stay put and wait and think that you'll get married, or you at some point you will get pregnant and just have babies. It's very important to be able to assess your health, to assess the state of your reproductive health early, much early, as part of planning your life. Because certain things like what we are talking about, endometriosis, fibroids, these things can be detected very early and treated very early. Remember, I told you fibroids can grow so large, and also endometriosis has stages. So the earlier you can be screened and treated, the better. That's why it's very, very important to share information, to share this information, to share my my YouTube channel, so that people can get to be educated about all these things. I know there are many other YouTube channels educating people about this, and I appreciate that so much. My interest is just to reach as many people, as many women as possible, because I know women's health issues can make someone so anxious or nervous, and can affect your life so, so badly. I always say that in the Western world, I think in countries like the US, or Switzerland, or Germany, or the UK, what I'm saying might not make so much sense, because people are so much accessible to healthcare. In other countries, like in Africa, in Kenya, it's luxury to to find, or it's a luxurious thing to do a woman's health check once in your lifetime, and it involves a lot of money. And that's why, for me, it's important that I speak to all types of people. I speak to everyone. It's really important for me that this message reaches everyone, young girls, women in their reproductive age, men as well, so that we are all sensitized, and so that we all take decisions that will be useful for our lives in future. When I was growing up, it was very, very difficult to get information. And then there are many things I came to learn too late, you know. But now I use my voice to educate young people, but also people of all ages, that you really need to take control, to take charge of your life. Don't be told by people what it should be like. You need to take control, and you only take control by um, by knowing. So knowledge is power. By knowing, and by being sensitive, or by knowing that it's not always, we can't see what is happening in the uterus. We are sitting on it. We don't know what's happening there. We don't see it. And so it's necessary to be aware of what's happening there. You may not be aware all the time completely, but once in a while, it's good to go for a check and take control of your future. If you take control of your reproductive health, you're really taking control of your future. Is there any other question in the chat? Hello, my dears. Hello, hello, all of you. Hello, dears. Thank you so much. Thank you so much again for checking, for tuning in. Thank you so much. Please share this video, share my videos with your friends, with other people, so that everyone is informed. Is there any other question? Just post the questions in the chat. My regards to you all. It's funny that we see each other only online. Yeah? I can't wait to see you guys physically, wherever you are. Mhm. So that was about fibroids. Actually, I talked so much about fibroids, just because it's connected to this chat. Uh, Super. Aileen Stephens is saying educative session. Thank you so much, Aileen. Thank you. I hope that Aurelia found the answer regarding the age limit. Um, yeah, and so um, what did I want to say? So these problems, as a woman, I don't want to project these issues as problems. These are issues which we all need to know. But I also want to say that being a woman is not only associated with problems. You know, Problems are there. Of course, I don't know what kind of problems affect men so much. And I am not probably an expert in that field to talk about, but every human being, or every gender, every sex, has its own issues and its own challenges. And there are many, many, many good things about being a girl, about being a woman. And so I do not want to portray the message of negativity towards the female gender. It's not. There are many, many, many other good things, good stuff. It's just unfortunate that there are so many health issues that affect the reproductive health system, and it's partly because the woman's body is driven so much by hormones. So I'm just looking in the chat. I think something passed me. Does some family planning methods be a reason for one getting endometriosis? Uh-huh. A very, very, very good question, Aileen. Very good question. Look, um, family planning methods playing a role in one getting endometriosis. I think you remind me of something very important. Um, so let me answer one question from Aileen, and then I will answer the other one from Aurelia. So, endometriosis does not have a cause. There is no known cause. So, if you ask me today, there is no science or there is no research that has said this is the cause of endometriosis. So, there is no known cause of endometriosis, but there are some concepts or some hypotheses how endometriosis is caused, and some scientists associated to epigenetics, that's a whole other area of science, the environment, and um, some genetic predispositions, and many other things. And that's why I spoke about managing endometriosis holistically using medicines, surgery, and diet and exercise. I forgot about exercise, and also psychosocial support. So diet and exercise play a very key role in preventing and managing endometriosis, but also, let me say, many other diseases that affect the human body. Never underestimate the effect of exercise and a natural diet. Natural diet, I mean, all those things we eat, all those leaves, all those vegetables we eat, all those tubers and roots we eat, and fruits, and of course, clean water. Never underestimate the role those play in preventing these diseases. So there is no known cause of endometriosis. There are just some hypotheses of how or what causes it. So very complicated. I'm sorry I cannot give you the answer, but the connection between endometriosis and family planning pills or family planning methods or contraceptives, it's delicate. One way of treating the first line of treating endometriosis is actually contraceptive pills. So we use pills um, to treat endometriosis as first line treatment. Therefore, it's not likely that the pills are causing endometriosis. Rather, the pills, they stop ovulation, um, they reduce, they inhibit growth of endometrial tissue in endometrium, you know. So the pills are acting actually against endometriosis. They are reducing the expression of endometriosis in the body. So I wouldn't say that they cause, but they are, of course, they are hormones, and there are some links um, between hormones and endometriosis. So the use of hormones, for me, it's controversial, and one has to take a very informed decision as to whether to use contraceptive pills or contraceptive hormones or not. But there is no direct association between contraceptives and endometriosis. Another question that has been posed, in the chat um, is that so if Aurelia, you're there, or if Aileen is there, please tell Aurelia about this. What are the main causes of fibroids? Aurelia asked about the main causes of fibroids. You know, all these things, um, there is no specific known cause, but for sure, genetic predisposition is there, lifestyle lifestyle issues are there. You know, like if you're eating inflammatory foods all the time, let's say you're always drinking Coca-Cola, drinking a lot of cow milk, eating a lot of red meat, um, drinking a lot of alcohol, smoking, and all those things, you know, all the irritants, all the foods that are considered inflammatory foods, and also lifestyle, and also a redundant lifestyle. You don't exercise and you have a genetic predisposition, you can always have fibroids. I know that in my family, we have, so far I know my sister has had fibroids, and I have, although they don't grow, they are really tiny. um, so there should be some genetic predisposition in that. And so, if they run in your family, be sure that it's likely that you are you are affected, but the real cause is really not known. And that's why lifestyle, exercise, and diet for me are the top on my list. You know, health, eating healthy, exercising, and living stress free. These are top um, on my list of things that you can do to prevent or to avoid developing this. But if you have a genetic predisposition, for sure you can do diets, you can eat healthy, you can observe all the golden rules of healthy living and still have endometriosis or fibroids. So that's how it is. So my dears, I am so happy that this is very interactive. I think I will write some responses in the chat, or maybe yeah, I don't need to write responses. Um I'm still thinking that we are on Zoom or something, because anyway this video will be recorded and you will hear the responses, because I was able to read the questions and give responses to them. So you can always have this video, and we can also have a one-on-one chat together to discuss all these things. You know, um, yeah, I'm here for you guys. I'm here for you, my viewer. I am not an expert. I don't know everything, but I am just here to share all I know regarding these issues, because I know some of these issues have affected me personally. They have affected my family, my friends. They have affected the people I work with. I have worked in hospitals where I have seen patients affected, and I know that whoever you are, wherever you are, you may be affected in one way or another. Even just knowing someone who is affected is really affecting you in one way or another. So I'm just here to share as much info as I can, all I know, because I think that together we can change something. Together we can support one another. Together, you know, if you hear it from me, you hear my experience, and you have been thinking your experience is so bad, you know, you feel so much better because you start to do this. Yeah, you relate, you start to relate, and you start to think, hey, I'm not alone. So speaking about things is like solving issues, solving problems halfway. That's what I believe. So that is what I had wanted to discuss today. I can see I still have someone in the chat. Sorry, yeah, in the live stream. I'm so glad. I'm so happy um, that it turned out like this, although I messed it up from the beginning. Um, from the questions I see in the chat, I think there is still need for me to address the issue of family planning. Yeah, yeah, the issue of family planning, I think is important to address, right? If you think that I should address, please write a comment. Yeah. Thank you so much. Aileen is saying great presentation. Thank you so much. You guys, or you may think that um, I am a pro. I am really learning. YouTube is the best school I have ever been to. I am learning to face the camera. I am learning to face myself. I am learning to deal with insecurities. I'm learning to show my imperfection because you can't fake it on YouTube, really. If there are people who are faking it, I don't know who they are, but in my case, I think you can't fake it. You just come with all your imperfections, boom, and you learn along the way. Thank you so much for appreciating me, for your appreciation, for your support, for joining in. Thank you so much for dealing with my imperfections. I hope that I have been able to pass the information to you. I hope that I've been able to share as much as I could. Um, I'm a bit tired and hungry. My voice, I see that my voice is really low. And I'm also using headphones because I got some feedback from one of my supporters that the volume of my videos is a bit low. And today I tried to use these headphones with the hope that they can improve my audio because unfortunately I didn't find a microphone that I could use on the computer. I found a small little microphone that I can use on my mobile phone. When I'm using the mobile phone, yes, I found something very small, micro, you um, how Bluetooth speaker or microphone, but I didn't find one for the computer. So if you have any ideas how I can improve my computer audio, please let me know. Please let me know. Thank you so much. And so I say that uh, thank you for my supporter, one of my viewers who told me that my audio is not good or is not sufficient and I could improve it. And I am trying to improve. That's why I'm using headphones today. And I hope that the audio from today's live will turn out a bit better. Mm. And please write me in the chat what topic you want me to address next, or what topic should I send you notes about. In the next live, I want us to go live, to continue going live and discussing these issues because I want them to reach as many people as possible. And I want to get your opinion about what I should address, what topic you want next. You know, I might be selecting topics to address, but then they not your priority. Your priority is my priority. Please write in the chat what you want me to address next, if you can. I'm just looking in the chat and I don't see something. And I was just wondering, now, I think there are so many myths associated with the topic that we have been discussing today. I mean, talking about cramps or painful periods and endometriosis and uterine fibroids. I think there's so many misconceptions and myths about them. I would really be grateful to know, like, what kind of misconceptions they are in your community, or what kind of myths and beliefs do people have in your community. Um, while I was growing up, it was just so shameful to talk about menstruation, for example, and so this was always a hidden thing. Um, Apart from when somebody had pain, like in the case of my elder sister, who was always sleeping like for the for one full week. She would just be crying and lying in bed and groaning and all those kind of things. Then we then you would definitely know this person is having a period if it's painful. Otherwise, some people conceal the pain and hide it and all those kind of things. But nowadays, because of social media, because of Google and a lot of information, um, maybe things have changed, but I'm not aware of what has changed. So, young people in different societies, you could tell me a bit what myths and beliefs and misconceptions do exist currently. Ah, okay. Hemolytic disease of the newborn, mother and fetus management. Aha. Oh, thank you, Aileen. Thank you so much. Very glad to see that. I will write it down. I will note it down on my topics to discuss next. Hemolytic. Aileen is saying that I should address hemolytic disease of the newborn. Yes, I love that. I love that. I love that. Hemolytic disease of the newborn, mother and fetus management. Yeah. Uh huh. Very well. Very well. Uh, Aileen, maybe one day we can do a Zoom meeting where we discuss these health issues together. You know, like record a Zoom and then post it here on YouTube, because I think we can exchange a lot. Yes, yes, indeed. I will plan this for the next one. Maybe first I will do a video. Actually, it's a very good video idea. It's something that affects a lot of people. Even me, even I was worried about this, you know, extremely worried about it. And especially if you are planning to have a baby, this is the one big concern that many people, many women have, the hemolytic disease of the newborn. Because sometimes you have issues happening to your pregnancy, or you have a birth and then something happens. And I don't know about you, Aileen, but I saw that in Kenya, there were so many people, so many women who did not know at all that they had who did not know at all what was happening, or about this issue of the hemolytic disease of the newborn, like what brings it about. You know, there are many factors. There are many factors. I don't want to go into to get into that now, but there are many factors, and all of these things should be actually screened before one thinks of becoming pregnant. And that's why I keep insisting that it's really important for everyone to consider checking their reproductive health, the women's health situation way, way, way before deciding to have a family. I would, in this era, I wouldn't wake up from one day to the other and think that I want to to have babies now. I would always consider first really having a comprehensive check of my body, of my women's health situation before putting myself into a family situation. I know this is difficult in practice, especially when you come from a context that does not really enable that. But I think for people in Western countries, what I'm talking about is like, what are you talking about? Because they are used to accessing healthcare really whenever they want, wherever, whatever, like they know there's nothing hidden. In my context where I grew up in Kenya, this is really relevant because there are people who were born and will die without having ever gone to a gynecologist or without ever having known what they carry in their body. So this is really important that people check. Maybe one day I have to organize a checkup for my loved ones because, as I said, as I keep saying, I have a lot of nieces, um, and I feel really as their aunt, as a woman, I really feel I should teach them everything and I should enable them take control of their reproductive health, their women's health, and take control of their future. So maybe it's something that I can organize later to give back, like a way of giving back, not just knowledge, but action. So let's see. Let's see. It's something I have in my thoughts. We will see. So I can see Aileen is still there. Thank you for being a very loyal viewer. Thank you so much. Um, I wish to end this live if there is no further question. Thank you, Aileen. Thank you, Aurelia. Thank you. I am Sangura. I know who you are. But because we are on YouTube, I just say like this. Thank you very much for checking in, for always supporting, for always being there. Um, of course, I will see you soon. I will write in the chat as well. You know what we need to do soon, huh? You know, I will write you very soon. I will write you actually tonight or tomorrow morning. We have to do something this weekend. So I have to leave. Do you have a question? My viewer who is there, shall I leave or not? Bye bye. Thank you so much. Thank you for those lovely emojis. Thank you. I don't see them. I don't know where to find them on my computer. Today is just a mess. I'm just in a mess. I don't know. I don't know anything on my computer. I am so digitally illiterate, but I am happy that we have been here, that we have shared information, we have exchanged, and I want to say bye bye, hello to everyone, and I will be in touch soon. Bye bye, and a big thanks. So, thank you so much. Thank you so much. Thank you so much. And Bye bye. Bye bye. Yeah, should I close? Should I not close? I hate to close it when I still have someone there. It's not fair. Uh, hello, hello. Still there. Bye bye, bye bye, bye bye, bye bye, bye bye. So, so let's see how many. Uh, so I will let you know. Oh my gosh, I don't know how best I can let people know about my life because today I messed up. I planned it early morning, but then when I went live, somehow people couldn't get in. They told me I was still private, and indeed I checked, and I saw that on the page where I had scheduled it, it was still seeming private, and I had to turn it on to public. Oh my goodness, and I had spoken already for an hour. I was just wondering why nobody was coming by until I was told that. So, really, if you know how best I can do a live, how best I can know what is happening, how best I can plan, if you know that, I'll be happy to share. If you could share that information with me. Thank you very much. And I say bye bye. I have to eat something. Bye bye.